Symptoms of BV versus chlamydia. I always think of topics to cover like as I'm getting ready, so that's why we're going to talk about this today. So with BV, or bacterial vaginosis, one, it can be asymptomatic, but that's a little bit more rare. The most common symptom is going to be abnormal discharge that has a bad odor. This odor is typically described as like a musty odor or a fishy odor, and the discharge can be like gray, like grayish or like yellow. So it might present differently for different people. I want to go over what actually causes BV. So if you think of the vagina naturally is full of a lot of different types of bacteria. When we start talking about BV, that means that one type of bacteria started to overgrow some of the other types of bacteria that then leads to this discharge, this musty, fishy odor, and that is BV. Another symptom would be that you can notice that the odor gets bad after intercourse or after having sex. Now, with chlamydia, this is a bacterial infection and it is a sexually transmitted infection. And chlamydia can present oftentimes with no symptoms, so asymptomatic, which is one of the reasons why we strongly encourage yearly testing, because some people just have it carried around and have no idea. Some people can also get abnormal discharge with chlamydia. They can also get pelvic pain because the dangers of chlamydia is it can cause scarring in the fallopian tubes and lead to a lot of pelvic pain. And ultimately, if you don't get treated and months and years go by, it can lead to infertility. For some, it can also cause pain with intercourse or pain during sex. And you might also notice maybe some post-coital bleeding or bleeding after sex. So that's another thing. So if you are sexually active, definitely recommend getting tested yearly for this. Now, if chlamydia is left untreated, up to 40% of women with it, it can cause long-term complications such as ectopic pregnancies, chronic pelvic pain, and, like I mentioned before, infertility. So here's your reminder: if you're sexually active, you haven't been tested, go get tested, and also have your partner or partners tested as well before you have intercourse with anyone new or new partner. Definitely recommend that you both have this discussion and both get tested if you're unsure.